How's it going, guys? So I figured I would do a video talking about my surgery, the breast reduction, if anyone that was like curious or possibly thinking about wanting to do the same thing, or really anything. I give some info on it in a way. I am currently roughly 5 days post-op, so things are still real rough. But like, particularly, I'm sitting here and it is not the most comfortable position, but there isn't a great or comfortable position to be sitting, so just gotta kind of work with it. The surgery itself wasn't bad. Like, I feel like my doctor was great. If you are thinking about getting it done, first recommendation, obviously you have to have large chest, but also make sure you already have like complaints to your other doctors or whoever about like back pain and shoulder pain and all of that, because otherwise, if you don't have that, that is one of the things you have to tick off on the list of things you have to tick off for insurance to cover it if you're in America. If you live anywhere else, probably won't have that issue. But America, sadly, that's a thing you have to worry about. And yes, so you gotta have like a list of things checked off for it to be considered a medical surgery versus a cosmetic surgery. And thankfully I got them all checked off. So definitely put in complaints about like having back pain, shoulder pain, all that. The nice thing is, after the surgery, once you get it done, right away, you notice like shoulder pain gone. Like you walk out and you're like, wow, this feels great. And then when the meds wear off, you don't feel so great anymore, but that's okay. That'll eventually go away. But yeah, complain about that. So that's already on your list. And also, you have to have like a minimum amount of tissue, we'll put it, taken off. That's another thing you have to take off. I forget exactly what the minimum amount was. I want to say it was roughly like 400 grams. So yeah. Make sure you got that. I don't know. I couldn't tell you how much that is in other form. You have to convert that yourself. I'm not doing that right now, sorry. I'll try sticking some photos of, like, I took like 2 photos, I think. I didn't do a lot of what I looked like in a t-shirt prior to the surgery, so then I can compare it with the same t-shirt on later on. I'm gonna wait maybe a little while to do that. We'll see, because it's kind of difficult to put t-shirts on right now. So button-ups, just make sure you got a lot of button-ups, because really that's only that your arms just don't want to do things. There's a lot of stitches, lots of stitches. But yeah, I walked out. I have some friends that had the same surgery done, and they had drainage, because when you have a surgery like that, sometimes you do. I don't, which is weird, and I can't tell you why, because I don't know why, but that's fine. I'm fine with that. I'm okay with not having drainage. It seems to be doing fine for me. The surgery was like 2 hours, and then there was roughly like an hour after that I kind of just hung out there for a bit, and they, like, keeping an eye on me and stuff. It wasn't too bad. It was definitely simply that, like, that was my first like big surgery. I've never had it. Like, I had my wisdom teeth taken out, so I had to be put under for that. That's like a different anesthesia. It was not the same. But I was pretty happy. Make sure you just get a good doctor that are like good and attentive, and they're not gonna just like rush you. It's never a good thing. Cleaning it wise, just mild soap on a wet cloth and just dab. That's pretty much all you really gotta do. I was able to take a shower like the next day. I had a follow-up appointment, and then they said I could just already start taking showers, which is beautiful because you really want to shower. And now I can just take showers regularly. Just be careful. And make sure the water's not too hot, because that will just suck. It don't look pretty right now, I can tell you that. I can't wait till it looks better. But like, such a difference. Myself, when I look at myself, like, this is a really big shirt, so this isn't how, but from prior to now already, and I'm still like swollen, so it's gonna like go down some too. I feel like I look like I lost like 10 to 15 pounds when I put like shirts on like this.
Figure it this way. It would be like,
I'm trying to be careful because this stitches, it would be like way further out. So it just makes you look bigger than you are. So, you know, it's down here and it's probably gonna do a little bit more down. And it's great. Now it's like, it's kind of itchy now because it's healing, and the only thing I can do is like put my hand here and just put the slightest bit of pressure. It does help, but it's annoying. I can't wait till it's healed, but they say it's gonna, like, the first 2 weeks is the worst. After that, it's just like, yeah, another like 2 weeks to a month before it's like fully healed. If you, job-wise, this is a thing. If you do like a desk job, after 2 weeks they say you can go back to work. I don't have a desk job, so I took like 3 weeks to a month off. We'll see how it goes. We haven't gotten that fully through. But yeah, I would recommend more time. I do a lot of lifting at my work, so I want more time off. We'll see how that goes. I think I'm gonna do 4 weeks either way, no matter what. If I get it off or not, I'm like gonna tell them I'm taking an extra week off. But yeah, there's bruising, there's a lot of stitches. It's not great, but it's gonna be worth it. Like, I notice my lower back doesn't hurt. I haven't had lower back pain since I left, and that was a constant for me. And I didn't even know I had like stress and like subtle pain in my shoulders until after, and then I was like, oh, my shoulders feel well, they feel way better. So that's kind of great. So I don't know, this is all just to like, if you were ever thinking about it, getting a reduction, I would recommend it. They told me that no one's ever complained about it. I don't have complaints, at least not right now. I guess if I have any, I'll let you know, but I don't right now. And I would recommend it. It's usually just more beneficial for your everyday life if you get it done. So if you're in the market and thinking about it, you know, just like kind of look at this as some tips and things of what to expect if you do it. But yeah, I just want to give a little update on it. I'll be putting not this kind of video stuff up next, but I just wanted to do this for you guys. Yeah, can't wait to wear normal shirts too, not just big old flannel. And pick up my cat. I can't pick things up. Forget about that. You can't lift things really. Don't do that. It's bad with the stitches. You know, you'll feel it. And I feel bad because my cat wants to keep getting picked up and I can't do it. He's over there right now. It's okay. Eventually I will. But yeah, I'll see you guys.